The Women's Health Initiative was a giant study of tens of thousands of postmenopausal women. Almost everything you hear or read about hormone replacement therapy for menopause is influenced by the Women's Health Initiative, even though it's been almost 20 years since that study was abruptly stopped. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Those are mostly about hormone optimization. Well, I'm especially interested in menopause. Obviously, I've never experienced menopause for myself, but I do talk to a lot of women who go through it, and I really empathize with their situation. I'm talking today about 10 specific words and phrases taken directly from the report of the Women's Health Initiative that kind of put the study into a little bit better context. Here's a direct quote from the report for the Women's Health Initiative. On May 31, 2002, after a mean of 5.2 years of follow-up, the Data and Safety Monitoring Board recommended stopping the trial of estrogen plus progestin versus placebo because the test statistic for invasive breast cancer exceeded the stopping boundary for this adverse effect, and the global index statistic supported risks exceeding benefits. So the safety board of the study recommended stopping the trial because of what appeared to be too many breast cancer cases in the treatment group. That is, too many cases of breast cancer in the women on hormones. Quote, the 26% increase, 38 versus 30 per 10,000 person years, observed in the estrogen plus progestin group almost reached nominal statistical significance. So when the authors list a 26% increase in breast cancer, that sounds pretty scary. Wow, it sounds like a lot more breast cancer. What we need to understand is that there was a 26% relative risk increase. It doesn't mean that 26% more people got breast cancer in the study. Relative risk is commonly used in research papers, and it sounds a lot scarier than it is. The key is the parentheses. A 26% increase, parentheses 38 versus 30 per 10,000 person years. Those parentheses tell us about the absolute cases of breast cancer in the study, basically adjusted based on 10,000 women. So the statement says 38 versus 30, which means around 30 women out of 10,000 were estimated to be at risk for breast cancer without hormones, but 38 out of 10,000 were at risk for breast cancer with hormones. So the absolute increase in breast cancer risk works out to 0.08%. Now let's look a little bit more closely at the word almost. The quote again is the 26% increase almost reached nominal statistical significance. By saying something almost reached statistical significance, it's exactly the same as saying it did not reach statistical significance. Now, if something doesn't reach statistical significance, that by definition means that the statistics show that it could have happened by chance. It's most likely not caused by the hormone replacement. So the headlines in all the newspapers and on the 5 o'clock news at the time of the WHI were all about an astounding, dangerous, scandalous 26% increase in breast cancer for patients taking hormone replacement therapy for menopause. Except it's not actually 26% increase, it's more like a 0.08% increase. The study was stopped because of what sounded like a big increase in breast cancer risk, except it wasn't that big, and it wasn't even statistically significant. It could have been higher by chance. It was such a small number. Here's another quote. This trial tested only one drug regimen, CEE 0.625 milligrams per day, plus MPA 2.5 milligrams per day in postmenopausal women with an intact uterus. The results do not necessarily apply to lower dosages of these drugs, to other formulations of oral estrogens and progestins, or to estrogens and progestins administered through the transdermal route. So when we look at the terms estrogen, they're talking about conjugated equine estrogen, which is derived from pregnant mare's urine. It's basically dried horse urine, and it contains anywhere from 10 to 60 different estrogens. Most of those are only found in horses, not in humans. It does contain less than 5% estradiol, that's the primary human estrogen. And when the study talks about progestin, it means medroxyprogesterone acetate, which is about 20 to 40 times more potent than progesterone, but it's similar to progesterone. It's used to prevent endometrial hyperplasia that's caused by unopposed estrogens. And it was withheld from some of the women in the study who had had a hysterectomy. So this quote, results do not necessarily apply to other hormone dosages or combinations. This is an explicit statement in the report from the WHI, but it's been completely ignored by every major physician organization and the FDA. There's now what's called a black box warning on any and all hormone replacement therapy, in bold print, warning patients about the dangers of hormones, even though the study itself says you can't apply those results to every other hormone. Now, there was an arm of the study that gave unopposed estrogen to some women who hadn't had a uterus because they had had a hysterectomy. The women receiving unopposed estrogen actually had a significantly lower risk of breast cancer. This doesn't conclusively prove anything, but it does kind of hint or point to the idea that estrogen wasn't the culprit in the very slightly increased risk for breast cancer. Maybe the medroxyprogesterone was the culprit. Here's another quote. The mean age of the patients in the study was 63.3 years. The menopause average age is 51. That means these patients were 12 years past menopause on average. They had no menopause symptoms because menopause symptoms actually disqualified the patients. They wouldn't be able to be blinded and not know which patient was getting the drug versus placebo. The study was also partially stopped because of significant increase in cardiovascular disease. But the fact that the average age of the patients in the study was 12 years past menopause might have had an impact on their hearts and their heart disease. This becomes especially pertinent when we realize that if we separate the patients out by age, the patients closer to menopause didn't have any increase in cardiovascular risk. The older patients did. So the study title was Risks and Benefits of Estrogen plus Progestin in Healthy Postmenopausal Women. Were they healthy or not? The mean basal metabolic index, or BMI, was 28.5, which made them all overweight. 50% of the women were either past or current smokers. 4.4% had diabetes, 12 to 13% had elevated cholesterol, 7% used statins for that cholesterol, 36% had high blood pressure, 1.6 to 1.9% had a history of heart attack before the study began, but only 1.9% of patients receiving hormones showed cardiovascular disease during the study, about the same as what had cardiovascular disease before the study. So in spite of what you may have heard or read about hormone replacement therapy, especially if you've read about the WHI warnings about breast cancer risk and heart attack risk with hormones, there's definitely some nuances to the study that you can only truly understand if you actually read it. If you take a very close look at the actual words used by the authors in presenting the study, you come to a real, maybe a different understanding of what the WHI says and what it doesn't say. If you're a hormone optimization provider and you'd like a few of my menopause specific references, including the Women's Health Initiative, click the link that says Menopause References and I'll zip some out to you in an email. And you can either print those out, I have a printable form that you can give to patients, or you can look at my online PubMed bibliography that I can share with you. If you're a patient looking for some help with menopause or maybe some other hormonal issue, I'd be happy to try and find somebody near you to help with your estradiol, your progesterone, and whatever other hormones might need to be optimized. Click my second link that says Find a Doctor and I'll see what I can do for you. I can't guarantee anything for either patients or physicians, but I'll give it my best shot. If this video has been helpful at all, click the like and subscribe buttons and get notified whenever I post a new one. Thanks so much for watching, and I look forward to talking to you again soon.